Hello, I'm Cecilia here, and I'm going to be speaking today about health-related grounds on the negative. I'm responding to some of the issues that Josh mentioned in his video about the subject. Josh stated that the human health-related grounds do not reduce immigration. Now, immigrants have lawfully entered America go through standard set of evaluations. The ones that don't enter lawfully obviously do not. That will grant entry if they have a healthy checklist, the ones that are legal. Things alone discounts the individuals that are able to reside in America, as many diseases are invisible and asymptomatic. Chapter 6 of Communicable Disease, Public Health Significance, December 10, 2019, states that applicants who have communicable diseases of public health significance are inadmissible. The Department of Health and Human Services has designated the following conditions as communicable diseases of public health threat and apply to immigration medical examinations conducted in or outside of America: gonorrhea, Hansen's disease, leprosy, syphilis, tuberculosis, active, non-active. Such diseases may potentially affect the health of the American public in general. That's why we want to have these things to people that are coming into the country. If anyone tests positive for these, they will not be allowed in the country, and this is a way to reduce immigration based on health-related issues. Wassim Ruth Ellen, Immigration Policies and Issues on Health-Related Grounds for Exclusion, August 13, 2014, states that as a history, humans infected with Ebola in West Africa, avian influenza in China, polio in the Middle East, and dengue fever in the Caribbean are examples of reports that heighten concerns about the health screening of people arriving in the United States. Under current law, foreign nationals who wish to come to the United States generally must obtain a visa and submit to an inspection to be admitted. One of the reasons why a foreign national might be deemed inadmissible is on health-related grounds. The disease that trigger inadmissibility in the Immigration and Nationality Act are those communicable diseases of public health significance. Like today, the most important one would be COVID. Vaccines are also a requirement before you enter the country, and a lot of people around the world are not vaccinated. As stated in Chapter 2, Medical Examinations and Vaccinations Record, October 8, 2019, USCIS, Class A conditions are medical conditions that render a person inadmissible and ineligible for a visa or adjustment status. A Class A medical condition is a communicable disease of public health significance. Per HHS regulation, a failure to present documentation of having received vaccinations against vaccine-preventable diseases is not an admissible place. Where a medical examination is required to determine the applicant's admissibility, the person must be examined by a physician. Mental health is also controlled before entering the country, and as stated by Ryan in his debate, trauma is an underlying cause for families that get separated through deportation or families that are not able to arrive. While mental health may not render an applicant inadmissible, it represents a departure from well-being that may be significant enough to interfere with the applicant's ability to care for himself or others. It requires extensive medical treatment or institutionalization in the future. All of this, of course, is being paid by the government through Medicaid. Chapter 2, Medical Examination, USCIS, October 8, 2019, states that present or past mental disorders with associated behavior of harmful behavior that is likely to reoccur or drug abuse is not admitted. Class B conditions are described as physical or mental health conditions, disease, or disabilities, serious in degree or permanent in nature. Someone that can cause harm to themselves or others is a national threat and should not be allowed to enter the country. Josh also states that undocumented immigrants do not get the same treatment as others. Just look at the COVID pandemic, and a particular one about a girl that was in the university, did not receive her monetary aid as everyone else from the government, and her family couldn't pay for things because they also didn't have a job. Well, the government is spending millions of dollars on healthcare and relief for legal residents. Why should they give money to undocumented people that do not pay taxes and support the government? America gave out billions to businesses during this COVID pandemic with PPP loans, emergency disaster loans, unemployment, and many others reliefs. But they, as citizens, not illegal people. We have the same problem with healthcare, and Josh mentions that the CARE Act and how it is accessible to the undocumented. Well, this accessibility is done through, again, Medicaid. And most undocumented people do not have the money for costs of healthcare insurance. The cost of immigrant Medicaid coverage under current policy, October 10, 2019, states that it is important to understand how this works. Immigrants, they are a total of 42% of Medicare cost. Non-immigrants, 26% of Medicare cost. The average immigrant is more than $2,000 per month. The normal Americans is about $1,500. This is not fair for people that do not pay taxes. I strongly feel that to prevent the excess strain on the economic situation in America, immigrants that are not legally entering the country should be deported because we do not know about their probable diseases they might have, if they have vaccines, if they have abilities to work and make money, if they have mental health issues. They cannot support themselves, and we should not be supporting these people. Thank you.